kids sleep, you have food. And she's like,
Hi everyone, welcome. We're going to start in just a few seconds if you don't mind muting yourself while we're waiting.
I go, it doesn't matter. I go, I just need to see that you got like work.
You're in. Hey everyone.
Okay, I think why don't we go ahead and get started. I know there's still some folks joining, but we want to make sure we take advantage of all our time. Thanks for being here this afternoon and hanging in. My name is Rebecca Gudeman, and I welcome you to Documenting, Protecting, and Sharing Sexual and Reproductive Health Information for Youth in Foster Care. And I'm joined here in this presentation by my illustrious colleague, Alexis. Alexis, do you want to introduce yourself?
Hey everyone, I'm Alexis Obina. I'm part of the Youth Advisory Board at RHEP and also a bachelor in social work. So I'm happy to be here.
Yeah, thank you. All right, so we would start, before we jump into sort of the law and the good practice, we thought we would start by just grounding ourselves a little bit in sort of this concept of sensitive and confidential. And so if you would just take a second and in the chat, just type in what information might you consider personal or sensitive or not want others to know you, or you think folks in general might consider it sensitive information.
Pregnancy, I feel that. Thank you, Crystal.
Any other ideas? What else might be sensitive or feel sort of personal? Things you may not want to tell friends, or you tell your friends and you don't want them to share.
I see STDs, testing for STI, pregnancy, etc., sexual health, so STD, STIs, reproductive problems, birth control, relationship, let me see, relationship status, sexual behaviors and sexual partners, period. Thank you guys.
Right, a lot of great answers. So yeah, I mean, you mentioned all of these. These are sort of the obvious ones, but I really appreciate just the sort of the relationship status in general, sexual orientation, gender identity. These are things that all of us can feel that we sort of want to be able to control information about. And when we think about why is confidentiality so important, things like sexuality, gender identity, sexual health, those are deeply personal. It's normal to want to feel like you want to be able to control where that information goes and who you share it with. That desire for privacy is normal, and it's a normal part of adolescent development. In fact, you know, when someone starts to hit 12, 13, and they put that sign on the door that says keep out, or they start closing their door where they never did, that's a good thing. That means that they're developing normally as an adolescent. And that's also when some of these questions and spaces around sexuality and gender identity become more important, and people really start to think about sort of who has my information. On this slide, you'll see a quote that I just really love. Confidentiality is a delicate bargain of trust. And I really like that because trust is at the center of privacy and confidentiality. And one of the things we'll talk about today is sort of this strange space where when we can trust someone and promise them confidentiality, it actually creates space for them to feel more willing to share and disclose and open up and not keep things private. And that's sort of this strange duality that we are dealing with. Youth in foster care have so few spaces that truly are confidential, and they've also had their trust broken so many times. So understanding this delicate bargain of trust is something that we really do owe youth in foster care. And in the end, I think we all feel more comfortable sharing what we know and when we know what to expect and how information might be used. Now we're entering today's conversation about law and good practice with some backdrop of sort of some basic laws, both at the federal and state level. It is important to acknowledge that both federal and state law require child welfare agencies to maintain health and education information in their files, and to share that information with certain individuals or agencies, such as a foster caregiver and the court. And we know that county placing agencies and caregivers play a critical role coordinating care for and facilitating delivery of health care to youth and child welfare. So it's not that we want an absolute wall for health information. Folks do need to be able to have relevant information in order to make sure that young people are supported and receive appropriate services. At the same time, there are also confidentiality laws, and child welfare agencies are required to honor those. And this can sometimes feel like there is conflict between the two, but the laws do allow a placing agency to satisfy its obligation in both regards, and we'll talk about that a little bit as we move forward today. So we're going to start by talking about confidentiality rights at the doctor's office. So when there's information that starts in that doctor's exam room, and then sort of who can access it. And we'll start there because access to appropriate health care is so critical. And because it is so critical, the law, both at the federal and state level, gives young people quite a bit of legal authority to protect their sensitive information. And this is not just sexual and reproductive health information. It also includes mental health information. But we're going to look at sort of rights in three contexts: medical, child welfare, and in the home. So let's start with medical. And one note is that the rights that we're about to talk about in the laws cover all youth in California, regardless whether or not you're in foster care. Senate Bill 89, which you've heard mentioned a few times today, underscored that foster youth don't lose their rights to confidentiality when they enter foster care. All right, Alexis.
Thanks, Rebecca. So right number one is the right to privacy in exams. So the right to privacy for examination or treatment by a medical provider, unless the youth specifically requests otherwise. And so that went out in the California Department of Social Services all county letter. And then I'll pass it back to you.
Okay, we're going to run through some rights and then we'll put them into practice. The next right is the right to consent or to decline certain healthcare. So all adolescents in California have the right at any age to consent to or refuse contraception, pregnancy testing, prenatal, postnatal care, or abortion, treatment of sexual assault. And when you are 12 or older, you have the right to consent to or decline HIV prevention and treatment, sexually transmitted infection, disease prevention or treatment, mental health counseling, and treatment for intimate partner violence. And this also ties to your right to confidentiality.
Yes. And so right number three would be the right to privacy and health information. And so the right to patient confidentiality regarding minor consent, including sexual and reproductive health services and records. And then again, that is from CDSS, just citing the HIPAA laws and California Civil and Health and Safety Codes. Pass it back to you.
Okay, so what do these rights mean in practice? The general rule for a healthcare provider is that a medical provider simply cannot share a youth's protected health information with a third party, such as a youth child welfare social worker or probation officer, without written consent from the young person, or unless there's a court order. And the foster youth has the right to authorize or deny disclosure of that information or parts of that with persons specifically selected. Alexis.
Thank you. So the case is for Jenny, And so Jenny is brought to the doctor for her annual health exam. She meets with the doctor privately and gets a prescription for birth control pills and a packet of pills to take home. So the question is, can the doctor tell the STRTP or the short-term residential treatment program staff about the birth control prescription? What do you think, Rebecca?
And we were gonna set this up as a poll, but basically we were zoomed out, so we're not even trying. So just take a second and think how you would answer that. And the answer to this question is very straightforward. The doctors, under both HIPAA and state law, cannot disclose information about contraception use to anyone, including the caregiver or the STRTP staff, unless Jenny has explicitly signed a written permission allowing the doctor to share that information with them, or there's a court order that explicitly requires them to share that information. All right.
So thank you. We're gonna move on to case example 2, which is paperwork. Jay is 15 and he attends his annual exam. So after discussion with Jay, the provider prescribes him PrEP, which is pre-exposure prophylaxis to prevent HIV infection. So Jay's healthcare provider is asked to fill out a medical form post-visit that he has an area to list any diagnosis and diagnosis and another area to list medications prescribed. So the question is, may the provider include information about the PrEP prescription in this paperwork?
So this question comes up a lot because as part of our duties as in the child welfare system, we are supposed to track health and education information. And when someone goes for example, for an annual physical, there is paperwork that a medical provider is supposed to fill out that lists diagnosis, medications, sort of any current needs, so that can be tracked in the health and education passport. But in this case, because this is a sensitive service that Jay can access on their own, under state and federal law, this information cannot be included on that form unless Jay has, again, given explicit written permission or there is a court order allowing that information to be listed on that form.
Yes. So, oh, sorry. All right. So, this is a new slide, right?
Yes.
Okay, good. J15 is prescribed PrEP, and so Jay signs a release form that says Jay's medical provider may share the information with his caseworker. So Jay explicitly says he does not want his biological parents to find out. So may the caseworker include information about the PrEP prescription in CWS CMS. So that's basically the system that social workers use to document like notes and whatnot on their cases. So they're foster youth. So what do you guys think? You could drop it in the chat. I see Daya said no. And then someone said, are these laws only for 12 and older youth, Rebecca?
That's a great question. So the right to confidentiality links back to the right to consent. And in California, minors of any age, so that means even under age 12, can consent to pregnancy-related care, so anything related to contraception, pregnancy, prenatal care, abortion, postnatal care. And then in order to consent to prevention of STIs or treatment of STIs, so Jay is getting PrEP, which is a prevention medication to prevent an STI, you need to be 12 or older. And we do have in the documents attached a chart that summarizes minor consent laws, so you can see exactly what ages they are for different kinds of healthcare services. So let's see, it looks like most folks are saying no to this case. So this is a great question, and this is an interesting and not uncommon one. Jay is like, I have a great relationship with my caseworker. I trust my caseworker. I'm willing to share this information. I'll sign a release form. But the caseworker has to think about the fact that Jay has said, I'm okay with you knowing this information, but maybe not everyone else. So we're actually going to have you hold this question and not answer it, because we're going to start digging into exactly this in our next section. Okay, so now let's talk about confidentiality rights outside the doctor's office. So information has now gone to a caseworker or a social worker, or maybe Jay has simply shared it with you. Before we talk about the laws, I think it's important to just sort of think about what I call the ripple effect. So a ripple effect is a situation in which one event produces effects which spread and produce further effects. You literally think of ripples on a lake. For most of us, when we tell our parent or our best friend or our partner a secret, it probably stays there. But for young people in foster care, there really can be a ripple effect, and we need to think about that. So you share with one person, and that person by law or policy feels or believes they need to share with someone else, maybe because it's a health and education passport, and so on. So when the information goes to a caseworker, like in Jay's case, it may not stay there. The social worker or the caseworker may feel an obligation to document that information in a case plan or in CWS CMS. But then think about who has access to that. And CWS CMS is used to create the health and education passport that can be attached to a court report. Once it goes to court, who has access to that? That may be where a bio parent or an attorney or a DA may see it. And so that original step of placing information into the health and education passport or into CWS CMS may lead to that ripple effect. And it doesn't mean we never do it, but it does mean we have to think about this. And it's really important that child welfare and caregivers have the information they need, both to provide good care and support, but also to advise young people about their own confidentiality rights and sort of the limits of confidentiality. And again, sometimes providing that information actually creates more of that trusting space where people feel safer disclosing. Okay, so with that said, let's talk about what the confidentiality rules are outside of a doctor's office. The first rule we wanted to flag is a general right of confidentiality that actually exists in our California Constitution. In addition to our federal constitution, every state has a constitution, and California's constitution includes an explicit right to privacy for all Californians. And our state Supreme Court has issued a ruling saying that this same right extends to all adolescents. And it's one reason, for example, that young people in our state have a right to privacy in pregnancy-related care, because that is something our Supreme Court said is protected under our state constitution.
Yes, and so the right number 2 is the specific rights in the Foster Youth Bill of Rights. So youth in foster care have the right to maintain privacy regarding sexual orientation and gender identity and expression unless the child permits the information to be disclosed or disclosure is required to protect their health and safety, or disclosure is compelled by law or a court order. So confidentiality of medical and mental health records, including but not limited to HIV status, substance use disorder, history and treatment, and sexual and reproductive health care consent within existing laws, and that is in the WIC codes. And then these rights, sorry, I had to read it off the slide, but these rights are listed in the Foster Youth Bill of Rights, Welfare and Institution Code, section 16001.9. Those numbers are very important and based on other statuses and other state constitutions.
All right, and the third right that we wanted to uplift is a right that all youth in foster care have to be informed of their Foster Youth Bill of Rights rights. So caseworkers, including social workers and probation officers, are required to discuss and explain to youth their personal rights, including the confidentiality rights we just mentioned, at any and all placement changes, and at a minimum every 6 months thereafter. And starting at age 10, workers are required to document at least once a year that they have had conversations about confidentiality rights with young people in foster care. So again, let's look at what this means in practice. So now the next series of questions actually come from an all-county information notice issued by CDSS. It's number I-0620. And so all of these answers that we're about to summarize come directly from them. So the first question, how should a caseworker document sexual and reproductive health information in CWS-CMS? So this sort of goes back to our situation of Jay. Jay has allowed the caseworker information about some preventive STI medication. What does the caseworker do with this information? And the answer from CDSS is you enter information, but you do so in a generalized manner to ensure the information is not publicly shared. And so some of the examples that CDSS provided, that examples of quotes you might use in CWS-CMS. Youth was prescribed medication for a sensitive health matter. Or the social worker and the youth discussed topics of reproductive health. And these would be for other scenarios other than Jay's. Social worker provided youth resources regarding reproductive health or offered to remove barriers the youth was experiencing related to reproductive health. For example, perhaps they supported them with transportation or making a medical appointment. So instead of explicitly flagging the type of medical appointment or transportation to which medical provider, the CDS-CMS would include this kind of language instead. And CDSS explained that while CWS-CMS is intended to be a confidential system, there are times when information that's in there may end up in the health and education passport, and in fact then into the court report. And so in order to ensure that there are no, that we don't need to worry about redactions later, this kind of documentation is appropriate. Another example of a question that comes from the same all-county information notice, what should be redacted for a court report? So let's say there is more explicit information that the CWS-CMS notes do say that Jay is receiving this prophylactic medication to prevent HIV in CWS-CMS. CDSS said that that information should be redacted prior to being submitted to a juvenile case. So it making sure that it doesn't get into the health and education passport or into the court report that is written up for the court at the next hearing. And CDS explicitly called out these categories as areas that you should look for and possibly redact if this information is explicitly in CWS-CMS and the young person has flagged it as an area in which they want confidentiality. All right, Alexis.
Thanks, Rebecca. So yeah, now we're gonna move on to the case example 3. And so sharing with the caregiver. So 12-year-old Chris has been diagnosed with an STI and has been prescribed medication that she needs to take for 2 weeks. Chris chooses to share this information with her caseworker, but states she is not comfortable sharing the information with her grandmother, who is Chris's current caregiver. So what should the caseworker tell grandma, if anything? She didn't hear me.
All right, Alexis, it's on you to answer this.
Oh, it's on me? Okay. I was like, wait. Okay, so let me just, I'm sorry, my camera's gonna cut off, but the caseworker does not need to share the details with the caregiver. Only information the caregiver needs to make sure Chris receives good care. So the caseworker could tell the caregiver the youth is on antibiotics for treatment of an infection. This is what could be included in the health and information passport. And the general statement is appropriate as the social worker has addressed the youth's health needs while honoring their privacy. It is not necessary to explain to the caregiver that the infection was sexually transmitted. If a caseworker is unsure whether information needs to be shared with the caregiver against the youth's wishes, the social worker or probation officer should consult with their supervisor and or county council.
And that's a great tip for anyone. Anytime you're struggling to figure out what information to include or what information you feel should be excluded, always checking back with supervisor and county council. CDSS has encouraged every county in California to have policies that address documentation and confidentiality. And so if your county, hopefully your county does have them, and if they don't, it's a great opportunity to ask about that and leverage the guidance that CDSS has been issuing. So to step back and sort of think about, well, okay, this is overwhelming. What do we do with information and how do we handle it? There's a sort of series of questions to think through. So in general, it depends on the source of the information, the desire of the youth, and the nature of the information. So the first thing to think about is this information being received by a medical provider? If so, then we really do have a much stricter set of laws. We have HIPAA to think about, and that really, as we said before, limits the ability to redisclose information unless we have the youth's written, not just verbal, but written permission, or we have a court order. So if the information is received from a medical provider, then it's pretty straightforward, yes or no. Yes, then we need to have those one of those two things in place. If it's not from the medical provider, maybe the young person disclosed it themselves to you because you've created a safe space for them as a caregiver or a caseworker or a CASA or an advocate. The next thing to think about is whether the youth has requested confidentiality. We do know that young people have some general rights to confidentiality, whether it's in the Foster Youth Bill of Rights or in the state constitution. And it's also just part of sort of ethical practice for us to do what we can to honor confidentiality while also making sure that young people understand that there are times and spaces where it may be important to share information. And that's the second question. Does a caseworker believe information would be important to share for supports or services? So for example, maybe the youth discloses their gender identity or that they're pregnant, and a caseworker or a caregiver believes it would be really helpful to connect this young person to supports. So for example, we really want to connect you to prenatal care because it's important to begin prenatal care early. Right now, about 20% of young people who become pregnant while in foster care don't get any prenatal care at all. And part of the reason is a fear of disclosing their status to someone in the system because they're afraid it's going to get out to their bio parents or it's going to jeopardize their placement. So this is a really important space where providing confidentiality may create space for someone to share information. And it doesn't mean that you just sit on it, but you can have a conversation with them and collaborate with them to talk about sort of why you might want to think about just sharing information discreetly. You can connect someone to prenatal care. You can connect them to someone who could talk to them about gender identity without it having to be documented in explicit detail in CWS CMS. Alexis is going to talk in a little bit about some talking tips, sort of how do you talk to a young person about confidentiality and sharing information from her own expertise and experience. Now, for some people, their pregnancy status isn't going to be something that they're concerned about disclosing. They won't have a problem with it being documented, but having that conversation means that they have felt empowered by you to own their own information. And then a final and important question to think about is whether any information that you receive is triggering any concerns you might have that a reasonable suspicion of abuse, sexual abuse, or exploitation. Anyone who is a mandated reporter of child abuse is required to report anything that they consider to be a reasonable suspicion of abuse. There are scenarios in which information related to sexual assault, sexual activity may end up triggering child abuse reporting. There's no discretion about that when you have a suspicion of abuse. But this is also why it's so important to have conversations up front with young people, letting them know the limits of confidentiality, that if you believe that they are at risk or are being harmed, you would need to report, not because the law requires you to, but because that's actually something that will help them. And then that way, if you provided that discussion about limits of confidentiality, and then you do end up having to report, they won't feel blindsided. They won't feel that critical trust has been broken. So in that sense, knowing the difference between abuse and normative sexual behavior is essential. Actions and activities that someone might take when they are 17 and would be considered normal are maybe not normal for someone who is 10 years old. And that's what our definitions of child abuse in state law say. We aren't going to go through all of those, but we do have a number of resources that address when sexual activity needs to be reported. There's a lot of concern and questions about voluntary sexual activity. If somebody tells you that they are engaging in sexual activity and they're under age 18, that isn't an automatic child abuse report. But if there are some significant age differences involved, so someone is 14 or 15 and engaging in sexual activity with someone who's greater than 21, or if they're under 14 and they're engaging in sexual activity with someone 14 or older, that is something that needs to be reported. But for example, an 18-year-old engaging in sexual activity with a 15-year-old does not automatically trigger a child abuse report just on their ages. Pregnancy in and of itself does not trigger a child abuse report. You report if you believe that there may be some coercion, exploitation, assault, or again, the significant age differences. And we do in the resources have more guidance on exactly what those laws say. But with that, I'm going to pass it to Alexis to just talk a little bit about sort of good practice for discussing confidentiality. Alexis.
Thanks, Rebecca. So yes, I think I like this little, oh no, my pictures didn't add, but that's okay. So I like the HEAL, the humanize, explain, and empower, acknowledge, and respect. So I was thinking like, what am I gonna say? And then I was like, oh, I know, because when I was like 16, 17, something like that, I went to like Planned Parenthood, and I was telling like my foster mom, you know, I'm gonna get on birth control and blah, blah, blah. And like, she never made a big deal about it. And she told me, you know, like, okay, well, just take the bus there, whatever. And then she never told my social worker though. And I didn't realize that until like now, that like they never had this conversation. And like, even I'm pretty sure, because I really liked my social worker when I got like older. So I'm pretty sure I told her, and like she never told my foster mom, which was cool because I don't think I told them that I told each other. And so it was really cool that they like respected me enough and respected like who I am as a person and my confidentiality enough to understand that, again, the reason why I got on birth control was not because of like anything that could be alarming or like considered child abuse. It was perfectly normal, healthy behaviors and like preventative measures. And so I really appreciated that. And then also my foster mom was really funny and like we used to be like, what is she talking about? Because she would be like, you can't go into people's rooms. Like, I don't care, even if, because, you know, in foster care, usually you share a room with someone. And even then she was like, you should still knock on the door because you don't know what people are doing in their room. And that's, you know, their right to do whatever they want. And I really valued that. I didn't understand it at the time. And we were like, this lady is like crazy. What does she think we're doing in our room? But I mean, it makes sense. And people need to have that privacy and that confidentiality and that right to explore their body. And I really value her for that. So I'll pass it back to you, Rebecca.
Thank you, Alexis. All right, we're going to open the chat in just a sec for the questions that have been coming in. So feel free to enter any questions you have. We just want to summarize with this slide, sort of law and best practice. So what do we recommend? Know what must be kept confidential by law and know what you're required to disclose. And then know what you may keep private. There's that sort of gray space, and that's really important too. Ask your leadership about documentation and redaction policies and procedures. Again, CDSS has explicitly suggested to all of the different county child welfare agencies that they develop policies in this area because it is such an area of confusion and concern, and it is so important. So ask what your policies say. And find out who you go to if you do have a question. Who is that county council? Who is that supervisor? Advise whenever you're working with a young person, before you get into those, you know, gory conversations, the detailed stuff, share the parameters of disclosure and documentation policies up front. What are those limits of confidentiality? Because we can't provide absolute confidentiality. None of us can. All we can do is let people know up front what to expect from us. Empower, to the extent you can, ask permission before you share or document sensitive information. Explain why disclosure might be helpful. Explaining why prenatal care is important. Explaining what gender identity options and information are out there. It's part of learning to be an adult, to learn how to access healthcare, to learn how to advocate for yourself. And this is a really important part of our work as well. And honor requests for discretion as possible. And then, especially as the CDSS guidance sort of gave us some suggestions, document, but generalize and redact as appropriate. We want to be able to provide everyone the information they need to effectively support access to healthcare, but do that in a way that is honoring confidentiality as much as possible. As we open it to questions, I'll just leave this slide with some of the links to the different resources that we mentioned today. And we also have them attached in the Sullivan's web platform below the link to this breakout session if you want it. All right, shall we see what questions we have? I see a question about psychotropic medication and documentation. What I will say is, even though minors 12 and older can consent to mental health counseling, they cannot consent to medication, psychotropic medication on their own. And as folks in the California child welfare system will know, medication actually requires a court order and is a separate process. There are permissions that need to be signed to release that information, but it is not the young person who signs it. That now there still are many ways we can engage and empower young people and have conversations about what information is being shared related to diagnosis and medication, but that is a little bit different psychotropic medication than other counseling records that they might have. Okay, let's see, Alexis or Kendra, if you've seen some other questions, let me know.
I don't think I see. I think we're just that good, Rebecca. We don't have any questions.
I don't see any questions as of right now, but yeah, feel free to drop any questions you do have in the chat.
So yeah, I think also maybe like kind of reminding people that like like if your foster parent is religious or something, that it doesn't affect, like it still shouldn't be able to affect like the the decisions that you want to make. Like maybe people feel like, you know, you shouldn't be on birth control for whatever reason, but you know, you have a right to your own body. So it's important to remember that.
Yeah, thank you, Alexis. That's really important. I appreciate you saying that. It's hard. A lot of us are coming into this work with our own histories and our own education, and it can be really confusing sort of in understanding how we keep our own lives separate from the work, especially when we're when we care so much.
For sure, because I hear that a lot.
And while we still have a second, I'm just going to shout out Alexis is about to be on a main stage panel for us. So appreciate her for that, and make sure that you check it out in a few minutes when we switch to the next. I think there's a short break when we go to the next section. Alexis, do you have any other wise truth bombs you want to drop on us?
Actually, I do. I don't know if I should say it, but I just want to say that this is something that's like a little bit unrelated, but also it goes into that confidentiality and that, like, you know, I don't know. But so California Youth Connection, we did the Funds for Youth, which turned into Checks for Us through Think of Us. And so that turned into the foster care stimulus payment. So if you guys haven't heard about that, please hear about it and tell other youth about it, because they're sending, you know, California got $44 million to provide for families and foster youth. But through that debit card and through that check, they're tracking the spending. And so all that information on the spending and the tracking of where you spend your money is going to be sent to Think of Us and the California Department of Social Services. And so they didn't tell people that, but you're able to withdraw that money. But I think it's just really important because, I mean, you know, for me, look, I got a massage one time and then I got an A on my test. And like, that's just how I self-care and prepare for a test. So like, people don't need to know that. And I don't need to justify why I need to get a massage. Maybe, you know, people would be like, maybe you can spend your money somewhere else, but people need to focus on mental health. It's important. And then also there's a question in the chat. So mental health diagnosis, are they not supposed to be in CWS, example, ADHD, anxiety, and associated medications? That's a question, I think, for you,
Yep.
Rebecca.
Yes.
Okay.
So there is a lot of stuff going on right now trying to figure out how to document mental health, because there's such a big push, whether it's with the CANS assessment, with CFTs, with the RHEP, to make sure that we are appropriately addressing mental health and do so in an early way, which is wonderful, and make sure people are connected. One of the things we heard on our panel earlier this morning was how difficult it is to find appropriate mental health services. So what I would say is take a look at All County Information Notice I-0620, which talks about sort of ways to document in a generalized way. If there are times where you feel that you need to put specific information. So one of the examples that I had a county share with me is, you know, a young person maybe is afraid to go to sleep at night in the dark because they had a history of being abused late at night in the dark. You don't necessarily need to know all of the details about why they're afraid of the dark, but a caregiver very much does need to know that they will struggle with darkness, and we need to just make sure that they get a nightlight. So thinking carefully about sort of what is that need to know information is some of the guidance you'll see in the CDS All County Information Notice, but in the end, I need to be careful and not provide specific legal guidance, but this would be a question that would be appropriate for policy, county policy. I see another question about documenting related to someone who's been a victim of human trafficking and was diagnosed with pelvic inflammatory disease, and how can that be documented in the RHEP? The PID very much would be something that the young person has a legal right to control the information about. So in the end, without a written permission from them or a court order, it can't be documented. It can't be disclosed without that. And so this is again someplace where you may need to put, maybe there is some generalized information about follow-up treatment. Is there an antibiotic? Is there, they need to return to a doctor at a certain date if there's information that needs to be shared in order to ensure that that person receives the health care they need, but try to excise any information that's actually disclosing protected health information. And it looks like we have run out of time. Thank you all so much for joining us. We really appreciate it. Thank you, Alexis.
Thank you all. Thank you, Rebecca. Be safe, everyone.
Thank
Thanks
you, Rebecca. Yes, we're going to guide everyone now back to the main stage for our Youth Advisory Board panel. Thank you.